Prostate cancer is a cancer of the prostate gland. This is an organ found in men that is part of the genital urinary system. So there are some people in the population that are at increased risk for developing prostate cancer. African Americans are known to develop prostate cancer earlier and often a more aggressive variant of prostate cancer. There can be family traits where if you have a strong family history of prostate cancer, then you may be at increased risk for developing prostate cancer at an earlier age that is also more aggressive. They've also identified several genetic mutations in the BRCA1 and BRCA2 gene that could potentially increase your risk of prostate cancer as well. So screening for prostate cancer is kind of controversial at this point. There are a lot of different organizations that really haven't pinned down who the best population to screen is. And part of the problem for that is that prostate cancer in most people is a very slow-growing disease. And what they're finding is that although we discover prostate cancer in lots of people, prostate cancer doesn't kill you. Oftentimes when we discover prostate cancer in an 80-year-old, they could go on and live 10 years with their prostate cancer. And they're much more likely to die of heart disease or coronary artery disease than they are to die of their prostate cancer. So typically what we would do is when a man approaches the age of 50, we'll sit down with them and just have an informed discussion. So this should really be a patient-driven decision, because right now the medical literature doesn't really have strong guidelines to say that screening everyone at age 50 is beneficial. If we were to do prostate cancer screening on folks and identify cancer, oftentimes the way that we would treat that would be with surgery, sometimes radiation therapy, sometimes hormonal therapy. But what we're finding is that if we screen everybody and put them through the surgery, put them through the radiation, put them through the hormonal therapy, the absolute benefit for the patient can be rather small. Prostate cancer can have a variety of symptoms. So early prostate cancer can sometimes manifest itself as increasing difficulty urinating, increased urinary frequency, so having to go to the bathroom numerous times. People may also begin to see blood in their urine. And so those are some of the earliest signs and symptoms that you might be developing a problem with your prostate. So depending on how early you catch it will often determine the chance for cure. So if you find a person with prostate cancer and it hasn't spread, then oftentimes it can be cured with surgery or with radiation therapy. If, however, you've discovered the prostate cancer and it's already spread to other organs or to the bones, then it would be considered incurable. So with prostate cancer, it's one of these diseases that's challenging to reduce your risk. Eating right, lots of fruits and vegetables, being physically fit, physically athletic, these things will help to lower your risk for developing prostate cancer. But more importantly, if you do develop prostate cancer, the healthier you are, the more fit you are, the better your nutritional status, then the more successful the outcomes are going to be across the board.